Good morning, students. Today we will start with the SPL Chapter 2 Role of the Government in Health. In democracy, people expect the government to work for their welfare, like education, health, employment, housing, electricity, development of roads, etc. If we correlate it with the present means COVID-19 epidemic, it is our government only which is taking the steps to prevent all its citizens from the effect of this epidemic. To keep us healthy and safe, the government has taken various steps like lockdown, Arogya Setu app, etc. Now we will start with our chapter. What do you understand by health? Health is a state of complete physical, mental, and social well being, and not merely absence of disease or infirmity. India has the largest number of medical colleges in the world. That's why produces largest number of doctors. Maximum of them settle in cities. India is the fourth largest producer of medicine in the world. So it also export them. As a large number of people do not get clean drinking water, so they suffer from communicable diseases like diarrhea, hepatitis, etc. Many of them do not get balanced diet and healthy and hygienic environment. A large number of people from other countries visit India for treatment. They are called medical tourists. To prevent and treat illness, we need health centers, hospitals, laboratories, ambulance services, blood banks, etc. In the same way, qualified doctors, nurses, health workers, and other health professionals are required to run all the facilities to advise, to diagnose, and to treat illness. There are two types of healthcare services. Today, we will discuss about public health services. Public health service is a chain of all health centers and hospitals which are run by the government. They provide services both in rural as well as in urban areas. They provide treatment free or at a very low cost. They take action to prevent the spread of diseases like malaria, jaundice, COVID-19, etc. The programs are organized by the government, but they would be effective only if everyone participate and cooperate. At village level, the government appoints a doctor, a nurse, and a village health worker. At district level, health centers are supervised by the district hospitals, and the large cities have many government hospitals. Now, I will make you understand with a story of Hakim Sheikh. Hakim Sheikh was a member of Paschim Banga Khet Mazdoor Society. It is an organization of agricultural laborers in West Bengal. One evening, accidentally, he fell off a running train and suffered head injuries. His situation was very critical. He was taken to the government hospital in Kolkata. but the hospital doctors refused to admit him because they did not have a spare bed. He was taken to other hospitals also, but there also the doctors they made different excuses like they do not have the facility or the specialized doctors. So they spent 14 hours in a critical state and visited 8 different hospitals, but none of them admitted him. Finally, he was taken in a private hospital where he received treatment. He spent a lot of money in his treatment, but he was very angry and upset with the indifferent attitude of all the government hospitals that refused to admit him. So, Hakim Sheikh filed a case against the government in the court. The court asked the state government to give Hakim Sheikh the money that he had spent on his treatment because it is the primary duty of the government to ensure the welfare of the people and provide healthcare facilities to all. About private health services we will discuss in the second part of the video.